First one.
Alright, we can delete the axial, oblique, and the optional. So click on this first, because this one's still selected.
This
yeah,
one?
there you go.
And which one?
Okay, and now you can click the one below it.
Oh. That's it?
Everything else will run.
Okay.
Axial, 2 coronals, and 2 sagittals seems pretty standard to me. Kind of bummed. I wanted to go over the anatomy in lecture first, but that's okay. So, let's open up the calibration. Just gonna drop it right here, right in the middle. Then you're gonna check it in all planes. Looks good. All right, save and scan. Okay, let's go into the axial. Let's open that up. So we'll leave the axial long because it's our only one, so we kind of want a good one. Yeah, let's window each one. Let's find our money slices. So on this plane, I like the tibial plateau, which is either one of those two. Probably the other one, might actually.
Oh, other one?
Yeah, probably, just because it's a little easier. This is the medial, and that's the lateral tibial plateau. This is the fibula, so you can always tell what's lateral if you can see the fibula.
Okay, so this
And
is
there's also
medial?
like a little indentation, like right here for the fibula on the tibia.
Okay.
Okay, so that money slice, let's over here, let's try to find, I like to angle with the tibia. Oh, what's going on?
Just checking in.
Alright. Go up 2. 1. Oh, okay, yeah. Alright, that's
This one?
it. Yep. Alright,
And
and then
this
down
one?
there we want to find the femoral condyles. So that looks, yeah, this is the money slice. So you can see the medial and the lateral condyles.
Medial and lateral?
Yes.
Okay.
Actually, no, that might be lateral. Normally it forms like an L shape for lateral, but I thought it was this side, but this is likely the rounded side. So I believe that's lateral and this is medial.
Is that good?
Okay, yeah, shin box looks good. Let's increase it in all 3 planes just because. Perfect, okay. There you go, love it. Okay, so I want you to use, yeah, perfect.
I watched the video before this.
Oh, okay.
Just a little bit.
She came prepared. Did you do it last week or what video?
We
From-
did it on a Saturday, yeah.
Perfect. And you know what to angle with in this plane and that plane?
Yes.
The structures we were trying to find in the money slices. So yeah, tibial plateau there. There you go. And then let's do the tibia here. Obviously, a little hard to see. But yeah, just use your judgment. Okay. So, alright, we'll rock that, why not?
Okay.
So, coverage. You want to make sure that you're covering the sides of the knees, the anterior and posterior of the knee, if possible. Often if they have like a really big thigh or leg, you're not going to be able to cover everything, like maybe in your top slices. Like see up here, even that's like barely covering it. So just do your best. But, okay, so coverage. We only need the head of the fibula, okay? So you can cut like 3 slices. Maybe 1 more. There you go, perfect. Okay?
And then this one was a patella, right?
Yeah, it's like 3 to 6 slices above the patella.
Is this the patella?
Yeah.
Oops.
That's okay. That's okay.
Maybe like
1 more. Yeah, so let's see. 1, 2, 3, 4, 5,
7.
6. Yeah, so we can cut it out. There you go. Alright, looks good to me. Why don't we scoot it posterior a little bit? You should do it down here. That way you don't risk moving it up or down. Over here you can only move it left and right. And
move it posterior.
yeah, so that one. A little bit more. Perfect. Yeah, it's a little close, but that's okay. Alright.
Okay.
Okay, looks
Okay.
good. Yep. We'll rock the 4 next because it's our only axial and we want something good to plan off of.
Okay.
Okay, let's go into the coronal. The ronal. And money slices. Yeah, that's the medial. It's more rounded. And that's the lateral. You can always tell the lateral because it forms more of an L. It's like a sharper thing, whereas the medial is more rounded. So yeah, this is the lateral and that's the medial.
Okay.
So lateral and medial condyles, lateral and medial epicondyles. Okay? Epicondyles. So I'll show you over here later on.
These
okay.
are the condyles, you said?
Yep.
And then these are the epicondyles.
Yep.
Okay.
Exactly. And if we scroll through here, other way. Lateral and medial epicondyles. So that's what we're seeing here and here. It's like this elevated like region. I don't really know how to describe it. And then when you scroll up, you'll see that you only get these. See, now that and this are the condyles right here. Does that make sense?
Mm-hmm.
And the intercondylar fossa residing in between them. So yeah, this would be the intercondylar fossa. Okay, continue. Yeah, you have your money slices.
That's pretty good.
Go back. Go back. Keep going. Back to where one more. I'd angle it slightly to the right. You can see a little bit right there. And
Okay.
yeah, okay. Sorry, that's just my OCD. Okay. Alright. So now we want to cover this, like, I like to cover everything in front of the patella personally, but you don't need the posterior fat of the knee. You only need the muscle. So let's cut, yeah. One more, or two more, sorry, three more. One, two. No, well, yeah, let's leave it like that.
Okay.
I like it like that. Only thing is, you angled the last one pretty significantly, and this one's not angled at all.
Okay.
So let's angle it a little bit. There you go. And then we could probably cut that one off the back again. Yeah, there you go. Are we getting anything in this front slice? You can cut that one. Yeah, there you go. Okay.
Okay.
Looks good. You have the head of the fibula here. You might have to bring it down just ever so slightly. Or we could scroll and find the head of the fibula first.
Isn't that?
Yeah, that looks good. Yeah, let's leave that. Okay.
Okay.
Love it. So, this one's planned and saved. What do we have to do? It's a
Check.
T1.
Okay.
Yeah, exactly. Okay. What's T1 range?
Is it 350 to 750?
Yep. Okay, cool. Perfect. You can save it. There you go. Now it's RX. And we can start our last one. So remember it was quiet. What does that mean? Yeah. There you go. Find our money slices. So you have your lateral condyle, lateral epicondyle, medial condyle, medial epicondyle. See how this side's a lot more rounded, and if you scroll up too, and this side forms that L shaped.
Mm-hmm.
It's almost L for lateral, whereas this side's a little bit more rounded typically.
Okay.
So you can always tell what's what based on that.
Okay. Lateral and medial.
Yeah, rounded medial, L for lateral. I know they both kind of form an L, but this one's a lot more rounded than this one.
Okay.
So we have a lot of space up here, but nothing back here. There.
Do I angle this one too?
Yeah, I would. I'd rotate it however much you did in the last two. Perfect. Okay.
And then,
Yeah, it's a. The sagittal is weird because you're probably going to move that down to
Yeah.
angle, and then you're going to move this down. So it's going to go down and back. Because on the axial, you're going to move it posterior, and on the corona, you're going to move it inferior. So we can recenter later. So yeah, let's make that. Move it a little lower on the tibial plateau right here. There you go. What are your thoughts?
Is that right?
Whatever you want. Honestly.
Okay.
I'm giving, if you guys haven't noticed, I've been giving you guys a lot more freedom in the last like 2 weeks. Because it's like, you guys are capable of scanning on your own. So, it's kind of, I'm gonna let you guys kind of make the decisions.
I want to move it, but I shouldn't,
Yeah,
right?
you can move it.
Oh,
I mean,
okay.
look, we're already off center. So,
Okay.
yeah. See how it went down when you moved it over here? And then when you moved it down over here, it went back. So,
That's
oh, it's pretty good.
okay. So I should move it back here?
Yeah, let's center that. Over, yeah. There you go. Okay, very nice. Now, it was quiet for a second. You always got to pay attention over here. Always, always, always. So, yeah. Okay, let's window that up slightly and to the left. There we go. Okay, now let's scroll through and make sure that the slices are covering the fibular head. So, hold on, stop right there. You see how the tibia has this indentation? That means the fibula resides right here, and that means it's the lateral aspect of the tibia. Whereas this side doesn't have nearly as much. Does that make sense? It's another indicator. But you can always tell that once you see the fibula, that that you're lateral. That it's the lateral aspect. Okay, so we want to cover 2 slices past the fibula. We want to make sure that we cover the fibular head inferiorly, so you probably move it down slightly.
Yes.
Yeah. There you go. Perfect. Okay. 2 slices past it, looks good. Scroll up and down and make sure you're not cutting off any muscle of the quadriceps femoris. Keep going. Down, 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 down. There we go. Yeah, we got it all right there. Okay, and now let's check the other side. Check the medial side. Okay, so wait, go back, go back, go back. Keep going, right there. Okay, so you can cut until you're like right here. You can cut 3. There you go. Okay. Alright, looks good to me.
Do I have to check over here too?
No. It's always easier over here. Over here you can only see like right here, and then right here, and then right here. Whereas here you can see like S to I. So I like doing coverage in the coronal. Okay, so you can say it's all good. It's a PD. You only really have to worry about T1s and maybe T2s for TR ranges. Like that's what you should primarily worry about. Don't get me wrong, you should always check it. But T1s are the most susceptible to being out of range. Okay, so take me to the viewer.
Wait.
There you go. Okay. Let's go to the axial. Viewer.
Wait.
Scroll up or down. Use the bar. There you go. Okay, so let's click right here. Okay, let's scroll through. We have the femur. Keep going. Quadriceps tendon. Quad tendon. Okay? Embedded within the tendon, you have the patella. And right here forms the patellar femoral joint. Okay, keep going. Keep going. Keep going. Keep going. Keep going. Keep going. Remember, L, lateral. Lateral epicondyle, lateral condyle. Rounded medial, medial condyle, medial epicondyle. Keep going. So inferior to the patella, now it's the same tendon or it's continuous with it, but this is considered the patellar tendon, no longer the quadriceps tendon. Okay, keep going. Keep going. Alright, there's the fibula. So if you scroll back up, keep going. Up, 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 up. Or other way, I'm sorry. No, yeah, up. Keep going, keep going. Right there. You have your tibial plateaus, which articulate with the femoral condyles. Okay, popliteal artery, gastrocnemius muscles. Let's go to the coronal.
Which one?
or T1, sorry. That's wrong. View or double click, either one. Alright, scroll through. So, femoral condyles, medial and lateral, because we have the fibula. Okay, keep going. You have the medial, keep going. Perfect, right there. Medial tibial plateau, lateral tibial plateau, intercondylar eminence, right here. And this right here, that gap in between the two condyles is the intercondylar fossa. Okay, keep scrolling. You have right here your lateral meniscus and medial meniscus attaching up here on the medial epicondyle. So medial condyle, lateral condyle, medial epicondyle, lateral epicondyle. So attaching right here, you have your MCL, and it courses right down to here. It's called the medial collateral ligament, MCL. And it has its counterpart over here, lateral epicondyle, LCL, the lateral collateral ligament. And then your PCL courses through here, and your ACL goes the other way. Okay, keep going. So you see right here how this has that more of an indentation? It means it's the lateral aspect of the tibia, whereas this side's a lot more straight. Okay, keep going. Keep going. Now you can see more of the menisci right there. A little bit less on that side because the, I want to say the lateral side has more. But okay, keep going, don't worry about it. So now you can see. The other one forms almost a ring. Okay, let's go into the sagittal. Keep going, go to midline. Perfect. Okay, so head of the fibula, right? Or I'm sorry, femur, right? Condyle. Patella. You have your patellar femoral joint right here. You have your quadriceps tendon, and this is embedded. The patella is embedded in the quadriceps tendon, and then keep scroll down. There you go. And now this is the image I was looking for. Perfect. So now, even though it's the same tendon, it is continuous, and now it continues as the patellar tendon and inserts down here on the tibial tuberosity. You see that little like protrusion right there? That's the insertment site of this tendon. Okay, so over here, that little frayed looking weird thing, it's because we got a weird slice of it. That's the ACL, anterior cruciate ligament. And then wait. Here is the PCL, the posterior cruciate ligament. And now these cross like that, hence cruciate, as in cross-like. Okay, so over here you have the soleus and gastrocnemius muscles, which insert right here on the right above the condyles of the femur. Down here you have the hamstrings muscles, so I think that would be biceps femoris right here. Keep going. Keep going. Okay, other way? I'm looking for a certain structure. Coursing this way, behind it is the popliteal artery. Popliteal, you're gonna have to know that. This might be hard to say. Keep going. Likely right there, but that looks like muscle almost. Hard to say, but it would course like right there. Popliteal artery. Okay, tibial plateau right here. Keep going. Tibial plateau, sorry, there you go. Now, other way, you can see the, oh wait, go back. You can see the posterior horn and anterior horn of the meniscus, and if you scroll through, you'll see them start to join, because it's a C, and we got the slice like right there, so that's why you're seeing an anterior and posterior horn. But if you scroll that way, then you can see, scroll, keep going, where they join. You can basically see the edge of it. So this is the lateral meniscus, because here you have the fibula. This is the fibular notch on the radius, or I'm sorry, on the tibia, where these two articulate. And between these two bones, you have the interosseous membrane. Anything else?
Oh, the same thing that was right here?
Yep, same thing down here. Okay, keep other way.
I got one more on the test.
She's like, quick, let me write that down. Let's So you can see how it comes up. Yeah, keep going. Calf muscles, soleus and gastrocnemius, and they insert right up here, right above the femoral condyles. Biceps femoris of the hamstrings. And yeah, can't really think of any other structures. Go back to midline for this, or not midline, but you know, the money slice. Right there. So, you guys ever heard of a Baker's cyst? Yeah, even better, even better. Baker's cyst.
Yeah, we've heard of it.
So
Did you
it's a cyst.
No, Colton
It's a
hasn't.
cyst in the posterior aspect of the knee. It would be back here. It's a fluid-filled cyst. Sometimes they solve themselves. Sometimes, you know, you may have to have some sort of aspiration or surgery or anti-inflammatory or, you know, if it's caused by arthritis or a torn ligament, it may be like, you know, some sort of medication for the arthritis or rest and ice for a torn ligament. So popliteal artery resides back here, and the Baker's cyst would be in the posterior aspect as well. Okay. All right, good job. What are you going to do before you grab your patient?